Okay, so to continue on number 2, because my story's so long and I went over time. So anyways, I've been in and out of the hospital with diarrhea and nausea and vomiting, and I was in ICU, not sure if I was going to make it or not, and because I was so weak and tired and they can't keep fluids in me, and I ended up with a huge butt issue. I'm sure somebody out there knows what I'm talking about. But anyways, I had a GI bleed, and just so many things have happened so quickly here that I'm really struggling for my life at this point. When I got out of ICU, and because of the diarrhea, and I don't have C. diff or anything like that, but they put me on, for the first time, they put me on Flagyl, and a very high dose of Flagyl to see if they could stop my diarrhea, and they also put me on prednisone. That's why my face looks the way it does. And when I went on Flagyl, like 5 days out, I went home, and I ended up having a seizure again, and now I'm back on seizure medicine and Keppra, and I started having severe pain. So again, you know, the doctors at Kaiser will not treat me for Lyme's, and so I finally made my appointment with a Lyme literate doctor. Thanks to all you Lymies out there. I'm going to see Dr. Stryker June 28th. And which can't come soon enough. I'm still on Flagyl, which has given me weird side effects. Very shaky, severe pain. I can't tell you, the pain is just killing me. I'm off balance, and sometimes I rock. I'm very shaky. You know, if I hold my hands out, I can show you. Well, I guess it doesn't show up as well, but I'm very shaky. I don't write like I do. I have a blurry vision. And I'm cyclic. So it's like every 3 to 4 weeks I go through the severe pain where it feels like the volume of the, like you're like a radio and you turn up the volume. I always have pain, but the volume's turned up really high for like a week of my cycle. I wanted to make this video so bad to say, if you have a child or you are suffering from some of these symptoms, or you've had a tick bite, to take it seriously, to take your antibiotics seriously, and to see a Lyme literate doctor. There's a lot of docs out there that don't have, are not literate on Lyme's, and that's how we're getting misdiagnosed with these other diagnoses. And it does get worse as time goes on, and I am worse, and I'm suffering, and I'm trying my best really at this point to stay alive. And so I would love to hear your comments. Also, I don't know if anybody out there that suffers from Lyme's has this symptom too, but my hands peel and break open and crack. I don't know if you can see it. No, you can't really see it, but they just crack open like really bad dry skin. And it's cyclic for me too. I can tell like when my diarrhea is getting worse and my body aches are getting worse. And I usually look at my hands will itch really bad, and then it's like an eczema sort of thing. I don't know if any of you Lymies out there have that, but if you do, let me know. I'm curious how you treat it. I have been taking Flagyl. I've been taking magnesium, because that does help with sort of the muscle cramping like I'm having right now. And anyways, I wish the best to everybody out there, and I hope I will continue to keep you updated. And I'm trying to get my information from Kaiser so that I can have it ready for my Lyme literate doctor, and hopefully he can see me sooner, because I really need to be seen as soon as possible, because my diarrhea is still there, and I'm just getting worse, and I feel terrible. I feel sick. The sickest I've ever felt. So if you think you have Lyme's, get tested for it. Hygienics. And if they tell you, if somebody other than Hygienics tells you you're negative, don't believe it. Get treated. Okay, I'm out. I'll talk to you guys soon.